a community wellness series where the overall goal of the series is to create community awareness about health and disease, and also to enhance self-care, reduce suffering, improve the quality of life, and increase healthy longevity. Just a few housekeeping announcements. Your cameras and microphones are turned off. So please do use the Q&A or the chat feature to type any questions or comments. Questions will be addressed at the end of the session. As a reminder, this is not a CME CPD activity, so no certificates of attendance will be issued. So much of the world today looks for health information online. A simple search displays a multitude of results within seconds. So how do you find quality information, health information online? And how do you sort fact from fiction? Our expert speaker, Ms. Jamie Gray, is here to shed some light on this very important topic. Ms. Jamie Gray is the director of the Health Sciences Library at Weill Cornell Medicine-Qatar. Previously, she served as a part of the library leadership team, both at Stanford School of Medicine's Lane Medical Library and the University of Washington's Health Sciences Library. Her professional interests are varied and include interprofessional leadership, evidence-based practice, and the library's role to address the social determinants of health. Ms. Gray holds a Master in Library Science from the University at Buffalo and a Master in Healthcare Administration and Interprofessional Leadership from the University of California in San Francisco. Ladies and gentlemen, please welcome our expert speaker, Ms. Jamie Gray.
Thank you so much, and thank you for that kind introduction. Let me just pull up my slides to share with everybody. Can everyone see my slides? Perfect.
Yes.
Great. Well, thank you all so much for joining me. I'm actually really excited to get to talk with you today about something that I would say is very near and dear to my heart, which is finding good quality health information, particularly online. And as a medical librarian, I think a lot about, the best way to teach future doctors how to stay on top of the evidence and to make the best care decisions that they can for their patients. But I also think that it's equally important that we as patients feel empowered and confident to find information to bring back and chat with our doctors about, so that way we can participate in our care really to the extent that we want to be involved. So as a daughter and a wife and a mother of 3, I can certainly know how tempting it can be to Google something when there's a health concern that's happening. So I really want to spend today to help you figure out how that way you can do that better. So hopefully what you're finding is reliable and trustworthy. So that's the goal of our time together today. So these are my disclosures. Nothing should be relevant to today's talk. Just a little bit about how we're going to spend our time today. We're really going to go over some of the basics of the health information ecosystem. We're going to talk a little bit about misinformation and disinformation and how those things are actually different. And then we're going to conclude today's session by looking at some best practices for searching and evaluation when you find the information that you're looking for. So to start, I want to talk a little bit about current technology and information habits. And we're going to look at access to the web. So there is a group called Digital Reportal who actually puts out a report every year, and it looks at the changes in online behavior and technology. So this information is from January 2022, so the report that was published this year. And in this report, they said that mobile phone usage has actually reached 5.13 billion unique phone users at this point. In addition, internet coverage has grown, and that is now reaching 4.95 billion internet users. And of those internet users, 92.1% have said that they use their phone to get online. And if you look at the global average for how much time we're actually spending in this online environment, we're up to about 6 hours and 28 minutes. So people are having better access, potentially quicker access, and we're spending a lot more time in this ecosystem. Now, if we look at social media specifically, this report says that 4.62 billion social media users are now across these platforms. And an important caveat here is that this number actually consists of multiple accounts that are connected to a single user. So one person might have a Twitter and a Facebook and a TikTok account. We're spending about an average time of 2 hours and 27 minutes per day on these platforms. And when they looked at the most popular apps that were being downloaded, the top 5 in the social media category were TikTok, Instagram, Facebook, WhatsApp, and Telegram. And it's interesting to note that of those 5 apps, Meta is actually the parent company for 3 of them, and that's Instagram, Facebook, and WhatsApp. So a lot of time being spent not only online, but in social media in particular. So with that in mind, I'm interested to know, for those of you who are on the call today, what social media or online resources are you using every day? And you can put your notes in the chat.
Okay, I'm seeing WhatsApp.
Yep.
Facebook, Twitter, WhatsApp, Instagram.
WhatsApp's popular.
Facebook, Instagram, WhatsApp, Facebook.
Perfect. Any others? Well, that gives us a pretty good spread, right? So obviously, I don't think any of this should be really surprising looking at the types of things that we're using. But if you think about social media in the context of news, right, where people get their news sources, Pew Research Center did a report in September of 2022. And when they looked at their sample of US adults, they found that 31% reported getting their news from Facebook on the regular, 25% reported getting their news from YouTube, and 14% reported getting their news from Twitter. Now, these numbers are not huge, but when you think about the number of users of these particular platforms, 25% could be pretty substantial. And I think it's an interesting insight that people aren't just using social media to connect with one another socially, they're also using it as a source of information. And an interesting note from this report, even though that Twitter wasn't particularly high in terms of their use, it ended up being about 3 in 10 adults. They found that 50% of the people who were using this platform were using it for news. Now, I think it's important to talk a little bit about how health information is actually different from other types of information that we look for. And one of the main ways that health information differs is the fact that it's high stakes. Most of the time when we're going and searching for information online, we're probably looking to purchase something, or maybe we want to go somewhere or research a vacation trip. And so if you think about that in terms of consequences, if you look up a wrong time or location for a movie that you're interested in going in and seeing, you'll probably be disappointed that you've missed the film, but the consequences are relatively minimal in this circumstance. But outdated or inaccurate health information can have anywhere from minor to significant health impacts that could actually span across the lifetime. In addition, health information is complicated. This information tends to be very technical. It changes quickly. So new literature is added every day. New discoveries are happening quite rapidly. And so the information in this area changes quite a bit. And finally, it's unique in the fact that it's contextual. Most of the time when we're looking for health information, it's because we need it for something. And each individual situation is actually quite unique because we're all unique as people. Now, navigating the online information ecosystem actually requires a lot of different skills. And the Australian government, when they were defining their style manual for developing online information, they highlighted these 4 different categories of skills. And I think they actually capture the searching process quite well. So they have broken these down into the category of operational, formal, information, and strategic. And so operational skills you can think about in the context of maybe being able to do a manual task. So this could be typing on the computer. Formal skills, an example would be jumping between different information sources for being able to go from a website to an app. Information is being able to find the right kind of information for the right question. And then strategic could be something like being able to brainstorm and pick the appropriate keywords. And so these categories actually fit quite nicely with what the definition of information literacy is. So the American Library Association, when they define information literacy, say that it's a set of integrated abilities encompassing the reflective discovery of information, the understanding of how information is produced and valued, and the use of information in creating new knowledge and participating ethically in communities of learning. And so this definition really encaptures all 4 of those skill types, but it's also talking about being able to have a certain knowledge in this area, the importance of context, and being able to engage in certain functions like being able to review for things for accuracy. And when you step back and look at the importance of information, we can see that this is actually a really important component of building what we call health literacy. So when we talk about people being health literate, it entails people's knowledge, motivation, and competencies to access, understand, appraise, and apply health information in order to make judgments and take decisions in everyday life concerning healthcare, disease prevention, and health promotion to maintain or improve quality of life during the life course. And that's a very robust definition, but I think it really gets to the heart of the matter, which is we need to be able to navigate our own health choices and behaviors, those of our families, how to interact with the healthcare system, and how to plan our health journey throughout the course of our life. Now, some people have said that health literacy can be thought of kind of in 3 very specific domains. And according to Nutbeam and Lloyd, those domains are functional, interactive, and critical health literacy. So if we think about examples, what each of these might look like, if we're talking about functional health literacy, this may show up in people's ability to make an appointment or to change their diet. If we think about interactive health literacy, this could be something along the lines of being able to find and evaluate information online and then being able to use it to make a healthcare decision. And critical health literacy could really be at that high level where maybe it's something like being able to understand the scientific literature and then being able to use that to create a evidence-informed school-based program for kids. So very different levels, but in today's session, I really want to focus on where we can find and how we can evaluate online sources. And that falls squarely at the interactive level. And the main reason for this is because, these skills are really important as we start talking about finding information that we can apply to our health and the health of our families. And in particular, we've really seen an increase in people searching for health information online. And this is a global phenomenon. So if we look at the data from Europe, looking at health information increased significantly over a 10-year, 11-year time period. So in 2010, 34% of people who were surveyed reported looking for health information online, and that number actually jumped to 55% in 2021. Similar trends can actually be seen in Turkey. So if we look at the age group of 25 to 34-year-olds, their online searching increased for health content from 52% in 2015 to 70% in 2020. In 2015, 11% of adults in the age group 55 to 64 were looking for online health information, and that actually jumped to 25% in 2020. So we're seeing this in all different areas of the globe. We're seeing this across age groups. And so I'm interested in what you think is the answer to this poll. So what percentage of daily online activity is attributed to finding health information in the Middle East? Go ahead and enter your answer. See some jumping, it's good. Great. Give a couple more seconds. One more second. And Raji, if you'll end the poll and show the answer. So most people thought about 10%, with 15% being a close second. Great. So the answer was Northwestern University in Qatar. When they did their most recent media use in the Middle East survey, they found that the nationals that they surveyed across 7 different countries, 18% of them reported searching for health information every single day. So 18% was the number. So to me, I think it's really clear that building good information, seeking, evaluation, and application skills is becoming more and more important. In particular, because the quality and reliability of information online can be so mixed. And I don't think that you can talk about finding good quality information without discussing the issue of misinformation as well. So, misinformation, disinformation, and malinformation are actually concepts that make up a larger concept called information disorder. And information disorder kind of looks at those things that are happening in the information ecosystem and ways that we can think about addressing them. So I think it's important to understand kind of the main differences between these 3 categories of information that also exist alongside the good quality information that we want to try and find. So misinformation is actually information that is false or incorrect, but it's not purposely trying to harm anyone. So this could be an example of information that's taken out of context, or maybe there's an error that's occurred. Disinformation is actually the opposite then. So it's false information, it's also inaccurate, but it's being put out in the ecosystem to create conflict or confusion around something. And so an example of this would be propaganda, is often disinformation. And then malinformation is a bit unique in that malinformation is true information. It's something that's true about, whoever, but it's released for the purposes to hurt or embarrass or harm. And so sometimes you can think about this in terms of, leaks about individuals or companies, that kind of stuff. Now, this image is to try and represent all of the different facets that are going on when we talk about health and misinformation and that ecosystem. And I want to be clear that there are actually a lot of factors that come into play and influence the topic of misinformation. And they're a mix of things that are at the individual and society level. And as you can see here, it ranges everything from education and culture to politics, to our own personal individual views and ways that we see the world. And so for our purposes today, what I really want to focus on are a few of the personal and technological factors that I think are important when we're searching online. And in particular, I want to focus on these because they're things that readily influence what ends up in front of us and whether or not we may believe that information or not. So in 2020, Shane put out a piece where they outlined some of the reasons that misinformation is so believable. And one of the reasons that we're susceptible to this type of information is our very human preference for simple, easy solutions. And when we look at simple, easy solutions, which makes sense because they're quick, it often gives preference to being able to make a quick judgment about something. And so this can actually be further influenced by what flags we look for to make these shortened judgments. And that's often referred to as heuristics. So you can think about this as, maybe that celebrity that you love, or a celebrity out in the world where they have a lot of influence, they have a lot of trust, and so people turn to them to look for information. So there's various biases that we all have that may be different from person to person, as well as something called cognitive dissonance, which is the rejection of information that doesn't fit our views. These things can often come into play. Fluency is actually a big factor. So, simple messages tend to be easier to understand versus very long, complicated explanations. And when they're repeated over and over and over again, that has a tendency to make them stick. And there are other personal level factors beyond this, and we're actually going to come back to one of those in a minute. But it's clear that there are mechanisms that bad actors can exploit to take advantage of these very human mental susceptibilities that we all have. And so there are some other very structural factors, I think, that come into play here as well. So one of these is the rapid dissemination of information. And I think this has changed quite a bit in the past decade. There's tools like social media now, which have really increased how quickly and how far information can travel. So back in 2010, it was estimated that stories from the New York Times were tweeted about once every 4 seconds. Once every 4 seconds. Now, thankfully, the New York Times has generally been classified as a reliable news source. But this example of speed in the online environment, I think, is really central, because research has shown that misinformation travels quicker than facts. So a study out of MIT in 2018, they tracked how false news spread over Twitter. And in their analysis, it took factual information 6 times as long as incorrect information to reach a total of 1,500 people. So the speed and the reach are 2 of the issues that we're dealing with today. Now, in addition to social media, there are also some potential issues related to how search engines actually work. So research in this area was looking at what we get back when we search. And this research has demonstrated that factors such as personalization, terms used, location, query type, which is what type of information you're actually looking for, as well as the actual search engine that's used. So whether you're using Google, Bing, something else, all of this can influence what search results are displayed to us, the end user. And so the information channels that we're using, how fast that information can travel, and the underlying structure of how information is actually retrieved and presented to us are 3 pretty technical considerations in the online environment that I think we need to be aware of. But there's also a human behavioral consideration, which can have influence on what we share, similar to what information we choose to look for. And one of the big factors is our emotions. So Berger and Milkman studied how emotions drove the sharing of New York Times articles. And emotions that had strong activation, and so they define this as those emotions that were more likely to make someone get up and do something, so they were motivated, ended up being more viral. And this was true for articles which inspired awe, as well as those articles that inspired anger. And so if you think about this in the context of health headlines that maybe show up in your news feed or are printed in a paper or on our online news media sources, you're probably more likely to see articles that highlight a breakthrough for something like a breakthrough drug for cancer, which would be awe and hope, or an experiment that had a negative side effect, which would be potentially fear and anger, then a study or information that's kind of reconfirming something that we're maybe already considering established fact. So, something like this, vegetables are an important part of a healthy diet. And it's not just Facebook and Twitter. Misinformation has been found on Instagram too. This chart is actually looking at a 3-month window from September to November of 2020. And it's the share of recommended posts containing misinformation. Unsurprisingly, COVID tops the list, with vaccines coming in second. You can turn to YouTube. There's multiple studies that have been conducted assessing content that's been found through this channel. And I think this makes a lot of sense given YouTube's popularity and the fact that it's also a platform that has visual medium on it. So looking at some of these studies, the one by Gobi and colleagues, in their research, they were looking at idiopathic pulmonary fibrosis. And from the sample of 102 videos that they looked at, 17% of those videos reviewed actually either recommended a treatment that was potentially harmful or one that was outside of the course of recommended treatment. Onder and Zagan, in their study of 240 videos, they identified 12.28%, which contained information that was misleading about gout. And on the last example, we hear the paper by Onder and colleagues on osteoporosis, which was published in 2022. They found 13.9% of the 238 videos that they included in their study were misleading in some way. And so all of this is not to say that you can't find reliable information on the internet. You most certainly can. But it does mean that we need to be really selective, that we need to effectively evaluate what we're finding, and that we need to pause before we send that information on to others. And so how do we actually do that? To start, we need to be really intentional and really choosy to some extent about where we go to look for information. So our last poll question for today, Raji, if you wouldn't mind launching it, which online health sources have the highest probability of being reliable? Great. Great. 10 more seconds. All right, let's close the poll. Right, so a lot of variation. WebMD came up as the top. So let me share the answer with you all. So go ahead and stop sharing. So the answer for this one is actually B and D. So looking for specific domain names can be really helpful in filtering information quickly. So one thing to note is that .com is usually reserved for commercial sites. So you can think Amazon and Carrefour. These are places that you usually go to look to buy a product. And when we look for health information, we want to try to identify sites that end in things like .gov, .edu, or .org. These endings specifically limit search results to things that are published in government, academic, or organizational websites. Now, that's not to say that things with .com don't end up being good, but this is one of the ways that you can quickly try to help filter through some of those, huge level of search results that you get back. So here are a few examples of reliable websites where you can find different types of health information. Now, I always encourage people to develop a habit of kind of having a few key resources that you can use to build your online information toolkit. And the reason why I suggest not relying on a single website is because no website is 100% comprehensive. You may also need different types of information at different points in time. So for example, when you first start learning about a condition or a test, a resource like Medline Plus might be really great. However, once you become familiar on a topic, a resource like PubMed might actually be better, particularly if you're starting to look for wanting to see that underlying scientific evidence. Now, even though you've gone to a reliable website, you still want to make sure that you're properly evaluating both the site and information. So I want to take a quick look at medlineplus.gov. And I really like recommending this resource because it provides a lot of different information across formats and across languages. And one of the first things you want to look for is who is the author of this website. So we can clearly see here that this product is created by the National Library of Medicine. And not only is this stated in the text, but if you were able to see the bottom of the screen grab, there's a variety of links that actually come from other government agencies like the NIH. And this website also ends in a .gov. When we click on the About page, we get a concise mission statement, as well as more key clues about the authority of the website. And we can see here that the National Library of Medicine is actually headed by Dr. Brennan, who has a nursing background and is actually part of the National Institutes of Health in the United States. When we click on the general information section, we see that there's a variety of different types of information that are listed. Some of this includes background information on the product, as well as how the content is actually selected for this website. And I think this is really important as it gets to two other key criteria, which is transparency and currency. So I want to look at the options that are presented. I'm really interested in learning about how content ends up in Medline Plus. So when we go into this section, we get a whole rundown about where the information comes from. And in this case, it's a mix of external and internally created content, as well as how often that information is actually updated. So looking at the example on medical tests, we can clearly see that this is information that's reviewed at a minimum of once every 3 years, and that this information could be reviewed more often if that's needed, which could be really helpful, particularly if you're looking at conditions where things tend to change quite rapidly. You'll also see that the date will appear of the last time that this content was reviewed. Now, for some of the other sections, I can see that there's editorial policies, which are talking about how externally information is included, and a few other details that, broken links are fixed. But all of these breadcrumbs are really there as clues to help us determine whether or not this website is reliable. Moving on to evaluation. There really are a number of different frameworks that are out there for evaluating online content. To help make this easier, I wanted to share two frameworks with you today that I think are particularly easy to remember. The first here is TRAP, and this covers several of the criteria that we just looked at, but I would say probably in slightly different and maybe more memorable terminology. So in TRAP, the T stands for timeliness. So this is, looking at the original date of publication, if there's any revision dates, looking to see if there's more recent publications that might answer your question better. R stands for relevance. So who is the information targeted to? Is the topic appropriate for your question? Are there sources that might be better suited for your specific information need at this point? The first A is for authority. So who is the author and are they qualified to speak on the subject? Is there a potential commercial interest? What kind of organization are they from? A looks at accuracy. So this gets to the reliability of the underlying evidence. Are they using emotional tactics? What editorial and review processes have gone into kind of reviewing this? And finally, P stands for purpose. So what's the goal of the information you're looking at? Is the information presented in a fair and balanced way? And is it biased in one way or another? So this mnemonic can be really helpful for evaluating both written and online content, particularly since, as I mentioned earlier, medical information changes quite rapidly. A similar strategy that you can implement is called SIFT. And SIFT, I would say, is particularly helpful when you're coming across things that are easily spread through social media, like videos and memes. So the letters for SIFT stand for, the S is stop. And so this is to stop and look at the information and see if you recognize the source and its subsequent reputation and influence. So if you need to think about whether or not you need to fact check this before you pass it along. I is for investigate the source. So who's written the piece and what is their affiliation, if any. F is for find better coverage. So we want to double check the claims that are being made in a piece, that they're actually factual and supported by best evidence. And it may mean that we need to look around and check several references to try and verify this if needed. And T stands for trace all claims back to their original source. So if something's being claimed and it's based on an article, I want to encourage you to go and find the original article and make sure that the message hasn't somehow gotten lost in translation. So this step is really about seeing the whole context surrounding a piece of information versus maybe that's just a snippet that's been grabbed and repackaged somewhere. So you can use these tools separately or together. And in a lot of ways, it'll really depend on what information you're actually trying to evaluate. So just a quick recap. We want to search for specific domains to try and help eliminate information quickly. We want to develop a resource of a few go-to sources to start your searching. And we want to use an evaluation method like the ones that we were just talking about. And all of these are good ways to try and ensure that you're getting the best quality information when you're trying to find something specifically related to health. Now, I also want to share one final strategy for those of you who are on the call that are maybe at the point in your healthcare journeys that you're interested in evaluating more of the scientific literature. So it's still really important that we take the time to evaluate things that are published in scientific journals. And I think the fact that these articles have gone through things like peer and editorial review is quite good. But different types of studies actually have their own unique set of strengths and weaknesses. And so we still want to look at how well studies were designed to take into account kind of these different factors. And in medicine, this is often referred to as critical appraisal. Now, there are a number of websites out there that offer critical appraisal checklists. Some of these are examples of like CASP and BMJ best practices. And I definitely recommend that you spend a little bit of time looking around to see which tool might be most appropriate for your particular situation. But for today's purposes, I want to use the Center for Evidence-Based Medicine, which is actually out of Oxford, as our example. And the reason for this is that their website is pretty easy to navigate, and they've also made their tools available in a number of different languages. So looking at their critical appraisals tool page, which is the first one you would come to trying to find these critical appraisal checklists, you see that it gives you a brief set of questions to consider before you even decide to undertake the appraisal process. And this is really important because say you're interested in finding a treatment for your 6-year-old, but you're coming through and you're searching through the literature and you find something that is a cutting edge experimental treatment, but it's done in a population that's 65-year-olds and older. That's probably not going to be applicable to the age group that you're interested in, which is children. So it's probably not even worth evaluating that at this point. So once you've found an article that you think is relevant, you can use these checklists that I'm going to share with you in a moment to evaluate the strength of the specific piece of evidence that you're interested in. So these checklists are really helpful because they give you very specific things to try and look for. So for example, if you're wanting to evaluate a randomized controlled trial, this checklist helps you look for particular clues like were the patients randomly assigned and how, and this is really important for this kind of study. how many patients made it through the trial, and if patients didn't, is it clear why or why not? All of these pieces can help you look at a study and say, yeah, I think this was done pretty well, and I want to take it and discuss it with my doctor, which is central here, right? We always want to take back information that we found and share it with our care provider. Or no, I think there's probably something better out there and I want to keep looking. So just a few parting thoughts as we wrap up. Looking at taking these behaviors as a whole, these strategies can really help to reduce the likelihood that outdated, irrelevant, or non-factual information ends up influencing your health choices and behaviors. So when we combine these discussions with our healthcare providers, things that we've learned today will help you feel a little bit more comfortable and a little bit more empowered to navigate this really rapidly changing ecosystem. And it does change quite rapidly. So we really want to be putting these things into practice when we're looking for information that's related to our health. So thank you all so much for your time today. I really appreciate you joining me. I'm happy to answer any questions. I want to thank my colleagues who helped me with this presentation, the references that were used to pull this together, and we will open it up.
Thank you so much, Jamie. This was just absolutely amazing. It's every time we hear you talk and we hear more about misinformation, more about disinformation. There's so much more evolving in this space. There's just so much happening. A lot of comments coming in, a lot of thank yous. Participants are appreciating your session, highly educative.
Thank you for joining.
Easily understandable, of value to my final year as well as my postgraduate students. So probably some educators out there. And I'm going to jump right into the questions. I know we have a couple of minutes for questions, Jamie. So the first question, with the plethora of health information and misinformation that is there online, can this information be regulated at a search engine level, maybe by the government, maybe by regulators, or so that the search gets more and more reliable? So any thoughts on that?
So there are discussions happening in this. I think you've seen some efforts, particularly from social media companies, about trying to figure out balancing people being able to have conversations, new discoveries happen, and trying to get to that information that maybe is not as helpful. I don't think we found a great way to do that yet. And for people who are actively participating in that ecosystem, I think they've gotten very adept at trying to get around these filters. So I definitely think that it's an area that we'll be paying attention to. And I think the pandemic really highlighted that. So I do think we'll be seeing more conversations and more developments that happen, but there's no one fit solution at this point. And I do think that there will probably need to be a lot of interprofessional collaboration and government involvement to try to figure out, how do we safeguard the system and still let people have the conversations they need to have and the good information get out there.
Thank you for that answer. On a continuum, there is a question. There is a person asking if there are any specifically government agencies that monitor and take action. If so, do you know of any of such agencies, and what measures might they take?
So I don't know about specific measures. I do know during the pandemic, the WHO was quite active in terms of trying to help address information when it came out. And there is a professional area of infodemic management that is looking at trying to effectively combat misinformation when it comes up, and thinking about that in different communities and different areas that misinformation tends to surface. So there is a discipline that I think is evolving and growing around infodemic management, but I don't know at the moment of any particular government steps to try and help address this, aside from, more education and paying more attention to it. But that's a really good question.
No, thank you for that. Thank you for that. So there's another question, and I think I think you put it so beautifully. You said misinformation is so believable because it's simple, and people are searching for that instant gratification, a quick fix solution, or they probably have an influencer who just bowls them over and sweeps them up. So this person is asking, so when it's so easy, how can you tell the difference between fact and opinion or fiction?
Oh, that's a good question, right? And I think that's where context becomes really important, right? And that's why I think it's so important to pause before we hit that send button, right? So I think we need to look at the context within which we're getting it. I think that's where those evaluation strategies like trap and sift become really important, right? Where you're looking at, where was this created? What is the intent behind it? Does it fit the purpose that I'm looking at this for? Do I need to do some more background checking to get a better sense of what this conversation looks like, right? So I think that's where it's really important that we feel empowered to go and do some of that investigation and just build that into our processes of how we think about information that comes across us.
Great, thank you. That was really comprehensive. So thank you so much. So some key takeaways for our audience this afternoon.
Yeah, evaluate. I would say that that's probably one of the main things that I would encourage people to do. Really put on that detective hat when you get information that comes across your desk, particularly when it's health related. Seek out librarians. We have a wonderful National Library here. If you have questions, come and ask. As librarians, we're always happy to help people track down and try to answer questions. And yeah, I think know that the good information is out there, and building a toolkit, I think, is one of the ways that it can really help you have a place to start finding health information when those questions arise. And obviously talk to your care provider. We really need to make sure that we're having those clinical conversations with the people that care for us when we're looking for that health information too. So I think it's kind of a two-step process in that way. You find your health information and then you talk to your care provider.
Excellent, excellent. So you go to the expert,
Exactly.
Very, very important.
Exactly.
Thank you so much. And just one thing that you would like our audience to rethink today or do differently today, just one thing.
One thing, I would say, put your evaluation strategies in play, whether that's SIFT or TRAP or something else that you find that resonates with you. Have your strategy so that way you feel empowered in terms of making your decisions around what information you think is appropriate for you.
So thank you. Excellent advice. So think of, evaluate before you hit that send button, and don't hit the send button and then think, oh, should I have sent that? So thank you so much, Jamie. Always a pleasure to hear you, to listen to you, and